I joined polio program in order to help my community.
خدمت کوچکی به طفل افغانستان خواهم میکنم که پولیو از بین بره فلج اطفال.
जब इंट्रा कैंपेन में ये डोर टू डोर जाती हैं तो सबसे पहला काम जो हम करने जा रहे हैं वो यही है कि हर बच्चे को वैक्सीनेट करें.
دیگه تقریبا روز 100 خانه ما میبینیم که در مجموع طفل نوکه‌باز طفل است 170 یا 180 طفل ما واکسین میکنه.
This is not an easy work. I usually work 5 to 6 hours every day.
जब मैं इस यूसी में आई तो यूसी में रिफ्यूजल्स की तादाद बहुत ज़्यादा थी.
At times, I met an angry mother or father who attack, abuse, and even threaten my life.
हर माँ पढ़ी लिखी नहीं होती है और हर माँ को ये अंदाज़ा नहीं होता कि इसकी क्या आफादियत हो सकती है, तो हमने कोशिश की कि उनके लिए आसानियाँ पैदा करें.
In my community, there was a family who always reject polio vaccination. After several visits, I was able to convince them. Now, all their eligible children are now vaccinated. This makes me feel happy.
دیگه خیلی خوشم که رضاکار و ما دوست داریم که ما دوست داریم که خدمت به جامعه خوب بکنه. ما خانم‌ها دوست داریم که
इस कैंपेन के बाद हम 139 रिफ्यूजल्स पे स्टिल आए हैं और मुझे पूरी उम्मीद है इंशाल्लाह हम नेक्स्ट कैंपेन में इन तमाम रिफ्यूजल्स में से भी कवरेज ज़रूर करेंगे.
Together we can end polio in Nigeria, Africa and the world. I will try my best. Hope you will too.
And we'll hear from, yeah, absolutely. We'll hear from Anita Zaidi in a moment on why women's health is good for all of us and why it's still not being prioritized as it should be. But let's begin our panel with Dr. Tedros. Dr. Tedros, how do you envision global health priorities changing over the next few years? And what are you excited about? And what are you worried about given this outlook?
Yeah, thank you. Maybe I would like to start from what you said, what I'm excited about. Maybe I would start from there. And you spoke about polio. If there is one thing that excites me, is about eradication of polio. We're very close. We're in the last lap. Of course, the last mile is the hardest, but that's when we need to really put all our energy to cross the finish line. And I would like to use this opportunity actually to thank Bill Gates for his passion and commitment to this for many years now, non-stop and continued. So I'm very grateful for that, and also to our host Saudi and all partners actually for their commitment to polio eradication. So that's one thing that excites me. And then the second one is especially technology. We have seen during COVID, for instance, in speeding up the development of vaccines and other tools, how technology is important. And we see it in other areas as well. So the use of technology, including AI, I think will change things, and we hope will narrow the gaps that we see in terms of access to health services. And then to the priorities, of course, I think the SDGs still holds, and we have to do everything to achieve the SDGs. Although, we are off track in terms of SDGs. For instance, if you take access, some examples, of course, Anita will speak about the mothers, but on, if I speak about children, we have 4.9 million deaths of children every year. That's a lot. And especially there are 54 countries with more than 25 per 1,000 doses, which are really far behind the SDG targets. So the commitment to SDGs is saving lives, as you said, especially our children, and thinking SDGs in terms of our children, in terms of the needless dying of mothers that Anita will say, is very important. So in terms of priority, it has to be the SDGs. Then two factors maybe in the SDGs I would like to add is in terms of access and financial hardships. 4.9 billion people now, as we speak, do not have access to the essential services they need based on a certain quality that the service should be provided. And 2 billion face financial hardship accessing services that could impoverish some of the families, by the way. So if we're talking about UHC and access, then the two factors are really important in regard to SDGs and our priorities. Of course, there are many other things that you know, the world is doing. I don't want to go into details of those, but I think these two measures, though, the access and the finance, are really critical, and that means there is a need for political commitment in order to improve access and also to address the financial hardships that 2 billion people are facing.
So making that clear link between the Sustainable Development Goals, the 4.9 billion people you talk about,
yes.
If you're going to tackle what you could call the global health crisis, that's where you have to put the attention. That's where it really matters.
Exactly.
Yeah.
That's where we should really focus.
Yeah. Prime Minister Sharif, let's talk about your country and as a specific example. In the face of the global health threats Dr. Tedros has just alluded to, can you talk about the systematic challenges you've negotiated when it comes to strengthening your health systems? What lessons do you think we can learn from your country's experience? And I just want to point out to the audience that you were chief, not just Prime Minister of Pakistan, of course, but also you were Chief Minister for Punjab for a very long time, tackling dengue, another real challenge.
Yes, thank you very much. Let me start from my personal example. In 2003, in this very country, when I was a guest of people of Saudi Arabia, I was in exile, I was struck by a very nasty cancer, adenocarcinoid. And I was flown to New York, and in Sloan Kettering I was operated upon. I had hemicolectomy, it was in the appendix, and I had to pay at that point in time thousands of dollars from my pocket. And I wondered how many people in my country can afford this kind of expensive treatment. And I said, not very many. Well, when I came back, mercifully I had lease of life, so came back to Pakistan, and I was elected the Chief Minister of Punjab. And we built hospitals dealing with kidney, liver, cancer, both by the governments, various governments, and philanthropists. Without going into details, that is the point at issue. That today, I think the first and foremost problem is global inequities. Now, look at COVID. It exposed these imbalances, gaps, hugely. Imagine global north and global south, distribution of vaccines, and so on and so forth. 2, climate change has completely changed the landscape. Pakistan does not contribute even a fraction of emissions, yet we are on the list, red list of climate change, and in 2022 we experienced the worst climate change floods in Pakistan, devastating everything from hospitals, schools, lands, agriculture, everything. And we had to invest hundreds of billions of rupees to rehabilitate people. But when it came to the question of seeking funds from abroad, those were loans, expensive loans. Can a developing country afford that? 3, if you want to use your meager resources to provide access to decent health care to the people, wherever there's a way, there's a will, there's a way. That's my belief. And as Chief Minister of Punjab, I, by the grace of God, was able to provide in the far nook and corner of my province. It's a province of 140 million people. Wonderful hepatitis facilities in every remote area of the province. Provided with CT scans all over the province. Poor people who are very in dire need of providing food and education to children cannot waste time. So I provided CT scans in their areas, which were the reports uploaded, brought to big centers of Punjab, and then the experts would look at that and send back the report in the evening, and they would get medical facilities. 3, I was able to, by the grace of God, build one of the finest hospital for kidney and liver in Lahore, which is probably the best in South Asia. And, poor people going to India, to China, expensive treatment, we offered them in Lahore, saving very, very, scarce foreign exchange and getting them free treatment who are poor, and we would charge who are rich. And this combination of cross-subsidy, we were able to provide facilities to the people. And then dengue, in 2011, it struck Pakistan, and most of all, it struck the city of Lahore. And he would bear me out. This dengue outbreak was probably the biggest around the globe. I have to confess here in front of this August Assembly, I didn't know much about dengue. Believe me, we collected experts, and then, from 6 in the morning till late night, I would have meetings. It was the entire government and civil society, philanthropists, experts, doctors, and common man. We all got them together. Went for lava, went for these brigades would go out and find various lava and trying to finish them through modern techniques. It was a challenge of sorts. I got machines flown by aircraft and placed in hospitals, and HDUs we established in all hospitals, and I, through law, through a decree, made it, in all laboratories responsible to provide these dengue tests at a very meager cost. And that's how we were able to control dengue.
And that's an extraordinary thing.
Sri Lanka, just 30 seconds.
Yeah.
Sri Lankans, they gave me a flashing sign that, Chief Minister, this year you will have deaths amounting to thousands of people. And I was dead scared. I couldn't sleep that night. But mercifully, through this collective efforts, only 250 people died. And next year, there were dengue patients, no death.
In Punjab, 100 million people? More than 100 million people?
140 million.
140 million.
Yeah, that's right, in Punjab.
Yeah.
And that became a test case around the globe, a study. I think this is how we can, achieve results through meager resources. But that does not mean that the yawning gap between global north and global south should not be arrested.
And I think what you've done there is really emphasize the on-the-ground work that you need to do. But of course, you also need finances. Your Excellency, Dr. Rabia, let me embarrass you a little bit by just pointing out the important role the Kingdom has played during the pandemic as chair of the G20, when it made significant contributions to finding new vaccines through support to the Coalition for Epidemic Preparedness Innovations, and making sure those vaccines are accessible to the most vulnerable communities in the world through Gavi, the Vaccine Alliance. KS Relief and the Kingdom has done extraordinary things. How has that impacted health outcomes across the world, and what more needs to be done to accelerate progress? I just wanted to ask His Excellency Dr. Rabia that question.
Well, thank you, Keir, and assalamu alaikum, everybody. What has been actually learned during COVID-19 is something that all of us should be careful with, that we don't repeat the mistakes that has happened because of the inequity and access and all of the challenges that has met us. And we know that it is very important that we should have a global coordinated response. We should have a global strategy. We should also have a very good communicated health system, and also decrease the funding gap to support health facilities. Let me start with Saudi Arabia. Saudi Arabia has done many actually efficient programs, starting with the local programs, regional and global. At a local program, and in front of me, the efficient Minister of Health, my friend Fahd Al-Jalajil, they have done very effective programs, whether with the digitalization, whether with the access to care, access to vaccination, access to diagnostics, including illegal migrants that have received the full care in Saudi Arabia. This program has represented a local model that has been transported regionally and globally. At a global level, Saudi Arabia has been one of the instrumental supporter of, as you mentioned, CARE SEPI for the vaccination industry and other initiatives. We have also supported the equity of.
सऊदी अरब की मेज़बानी में आलमी इक़्तिसादी फोरम का इजलास, शहबाज शरीफ समेत 1000 से ज़ायद आलमी रहनुमाओं ने शिरकत की। आपने बराह रास्त मुलाहिज़ा किया।